Hi, Jill.
Hello, can you hear me there?
Yes. How are you, Dave?
Good, good. Hi, everyone. Thanks so much for joining. I see we have Kulwinder, who's an Ayurvedic doctor on our team. I'm so glad to have you here, and Dr. Kettles, and all of you. Thank you so much for joining us today. And I definitely want to share a couple of interesting perspectives that sort of my journey with Ayurveda. So I had and different perspectives. So one of them is actually some interesting medical correlations that have arisen over time. And one of them is actually emerging with the human genome work, where they're looking at genetic variations or single nucleotide polymorphisms and observing sort of patterns among them. And it's interesting that we see these influence many things. Some of you may have heard of nutrigenomics, where there's certain genetic types that might respond to certain types of diets better than others, fasting versus not fasting. In fact, the diet and the nutritional evidence is becoming more and more intricate, where we see sometimes um, there's actually different strokes for different folks, something that Ayurveda has directed us to. We see that even in the use of medications. I was looking at a study where it showed in 30% of people, tramadol was actually far more efficacious, for example, than codeine. In 30% of people, it was about the same. And in 30% of people, actually did nothing at all. So we
Mhm.
see this interesting data. If you were to do a clinical trial, it would show up as being everybody, the responders would essentially balance the non-responders, and you'd have this sort of flat effect as if it didn't do anything. But it was actually who it was being treated in, who was being provided that treatment. Now we're even seeing this with antidepressants or psychiatric meds. We call it pill check or pharmacogenomics. And we're seeing this with many medication. And there's now studies showing that we actually have greater response if we can tailor the meds. Now, what happens to a casual observer is we might think that that's still distinct from what's being described in Ayurveda. But over time, what I began to discover was that they were predictable, that I could actually guess who was going to have the catecholamine methyl transferase SNP because they were the vatas. So it often correlated more than we would realize. And mysteriously, I couldn't fully explain it. Um, and we began to observe this trend and with more and more things within medicine. So this was something I observed clinically. I had other experiences. Um, One was actually, I myself struggled to refer to Ayurveda, even though we're one of the largest migraine practices for a single physician in Alberta, but I would hesitate because I would have this doubt, well, how do I know if it'll really help? And there was a time that I realized that these clinical trials would be difficult to design. What I discovered in time was what I discovered in time was that it was fully possible. And in fact, there is beautiful randomized controlled trials now beginning to look at Ayurvedic interventions, and they show incredible promise. In fact, in several of the studies, and in fact, in the majority of the studies that have now been done, they basically rival or exceed the best clinical outcomes of our current care. It was amazing to see this. Um, so many of the things that Jill is speaking to are really quite tremendous. And the other instance that I had was I began to see it clinically in patients. So from a Western medicine perspective, to be honest, it sounded very archaic to me. When I first heard it, it sounded a little bit like early European medicine, where they talked about the cholerics and the phlegmatics and the melancholies and the different humors that were in them. But it was only when I began to see it and understand the concepts, I would just predictably identify, and I would already know what the patient's going to tell me. I could actually sit to a couple and say, one couple, I'd say, well, you probably react to this like this, and you react to it like this. And they would say, how did you know? And it was because one is kapha and one was vata. And so I already know how they'll react in different meds and different treatments. So you begin to see it, it becomes part of your life. But probably the most compelling instance for me was when I came upon a book called Dhanvantri. And it was a beautifully well written book made for sort of a beginner wanting to explore Ayurveda. And I went through and I actually followed the book as I went through it. And I began to, again, recognize the patterns within myself. And I could actually see, first of all, the constellation of symptoms, whether it was, even as Jill mentioned, vata, hypermobility, prone to joint injuries. If you look, these are all the things that were vata, were many things that I'd suffered from. But I also noticed that the remedy, the vata vulnerability, for example, to viral infections were all things that I had. Um, But if I actually began to identify and assume that the Ayurveda was correct and began to immediately go to the sort of remedy that might emerge, not necessarily even a treatment in terms of a herb but just the lifestyle accommodation that's recommended in Ayurveda,
Yeah.
it would resolve. And so this was actually the healthiest that I've ever been in my life is when I actually studied Dhanvantari and followed it. That there was not a single point in the body where there was aches or pains, my sleep, viral infections, all those things. I cannot describe how good I felt. So it is incredible. Now, the challenge that emerges with Ayurveda is, in fact, that application. That it's easier to take a pill or get an injection than it is to change your life, and most of all, to change your understanding and your sensitivity and your awareness and your perception of your own well-being. And that's actually one of the hardest things to do. And that also ties into many things, relationships, and many other variables. So I discovered it was quite difficult. And that's one of the things which I think is the real magic of you is there's a principle now that's emerged in medicine. You may have heard of this when you read self-help books called self-efficacy. In Ayurveda, they call this sankalpa shakti. And basically, it's our power to be able to actually apply resolutions and make habit changes. So this is work that was done more than 7,000 years ago that essentially is capturing the idea of tiny incremental habit changes over a period of time. People overestimate how much they could transform their lives in a month, and they underestimate how much they could transform their entire world in a year.
Mm-hmm.
And this is the essence of Ayurveda. And this is what Jill helps us. It's slowly, gently, enjoyably, with great insight and awareness, transforming your life a habit at a time, a week at a time. And so definitely I invite you on a journey with Jill and with the Year of You and the Sister Science, and really feel that it will change your lives. I can actually tell in our team, and some people have done this process, even working with them, it has completely transformed our clinic and it's transformed even our relationships. Because even though her program is very body based, it gives you profound self-awareness because your body also, as Annemiek has alluded to in some of her talks, actually also is a window in to many other layers of perception. So it actually becomes a very transformative relationship with your mind, with your heart, with your relationships and those around you. So I invite you all to join that journey, and looking forward to seeing you in these groups in the days to come.
Dave, thank you so much. I loved when you said it was just like your awareness of how things were showing up with you was actually, there was a pattern to it and there was a system to it, because I think that's what it is. As we start to study Ayurveda, it all comes down to our awareness. I think my favorite quote is Eckhart Tolle says, awareness is the greatest agent of change. If we can apply our awareness to our own being and give ourselves the vocabulary and the context and the paradigm to understand that awareness, then all of a sudden we have this really powerful ability to apply resolution, like you said. Yay! I get so jazzed about this. Thank you, Dave, for commenting, and thank you guys all for being here tonight. Does anyone else have anything they want to say before we go? I appreciate you all so much. Yeah. Enjoy the rest of your Wednesday evening. We've watched the sunset as we've been here tonight. I appreciate you. Thank you so much. Hopefully we'll see you next week.
Take care.
Take care. Bye.
Bye.